Is starting a YouTube channel at the age of 45 insane? My thoughts coming up. But first, hello everyone. My name is Ray, and I'm a nurse practitioner who specializes in cardiology, hospital-based medicine. If you're new to the channel, welcome. If you're not new, welcome back. In this channel, we like to talk about heart disease, both prevention and treatment, other topics related to the heart and overall health and well-being. So if that sounds good to you, please consider subscribing so you can become a part of this growing community interested in improving our health and lifespan. Recently at work, there was a shift in my schedule that came on kind of suddenly, where I was told that my hours were going to be cut dramatically. You see, I work in the hospital in cardiology, and it's a very busy specialty. In fact, cardiology is consulted on a little over 26% of general hospital admissions, so about 1 in 4 of the hospitalized patients get a cardiac consult. I work PRN, or as needed, for the past few years, and I've always been needed quite a bit, so I didn't really have much time to pursue starting a YouTube channel, despite wanting to for quite a few years. I finally had the time to dedicate and focus on content creation. So why did I start this channel? I'm going to be a little bit blunt here, but I think our healthcare system is kind of broken. Admittedly, I've benefited very much so from our broken healthcare, but it doesn't change the fact that it's broken and it needs to be overhauled. When I worked in primary care, I saw a patient every 20 minutes, and that's pretty good compared to the doctor seeing a patient every 10 to 15 minutes. It's no wonder why patients get the impression that doctors spend way too little time and spend way less time than nurse practitioners do with the patients, but even in the hospital, our time is limited. My typical day consists of going to see either new consults or follow-ups from the previous day, ask them some questions, get a health and physical assessment on them about why they're in the hospital, and then pretty much determine what needs to be done quickly to get them out of the hospital ASAP. In hospital-based medicine, we say things like the discharge process starts the moment the patients walk through our doors. So what does that tell you? That tells you that the system is not really set up to encourage health promotion or education. Oh, sure, you'll hear things like in textbooks that we're educators first and caregivers second, but the harsh reality is that our bean counters are more interested in us getting in and out like a vapor trail so we can get patients out of the hospital quickly before we get dinged by payers such as Medicare. After I see the patients, the doctors typically will come in and round with me and see the patients for about a minute or two before they have to go to a full day of clinic. When am I supposed to talk to my patients about diet, weight loss, optimizing their sleep, getting daily sunshine, having a spiritual connection, starting an exercise program? Might sound like I'm making excuses, but it's quite the opposite. I'm actually sounding the alarm. I want to be a change agent, but until I can make a dent in that broken system, I'm going to take advantage of the YouTube platform to reach people before they get to the hospital, before they come to see me. YouTube, I hear, is the largest streaming platform out there, surpassing even Netflix. For years now, you've heard jokes about learning how to do something on YouTube, like, oh, I YouTubed it last night. Well, guess what? During my last year of nurse practitioner school in 2020 was when the global pandemic COVID-19 happened, and my professors had to get pretty creative and do a lot of YouTube lectures, and I learned quite a bit on YouTube. So back to the original question. Am I insane to think that I could possibly gain some traction at my age in 2025, almost heading into 2026? Possibly, but I'll tell you this. I think if we harness the power of YouTube platform and use it for educational content, I truly believe that we could change people's lives. I know there are a lot of big content creators out there with millions of subscribers and everyone is competing for your time. But I'm just going to continue to do what my heart tells me and put my heart and soul into this channel and share my passion and keep doing what I love. And just remember that even if one person out there gets some value, I'll feel like I'll have accomplished something good. So if you've made it this far, thanks for watching. Again, if you haven't subscribed to the channel, please consider doing so, and I hope to see you in the next video. God bless you.